Knock, knock, can I come in?
Yep.
Hi, I'm Valerie.
Hi.
I'm gonna shut the door for some privacy, wash my hands. Can you tell me your name and your birthday, please?
Sure, Joe W. 1/12/92.
Joe, thank you. What I'm gonna do today is I'm gonna assess your cranial nerves. I'm gonna make some sounds and touch your head. Is that okay?
Yeah.
Okay, wonderful. Now, Joe is alert, sitting upright, no signs of distress. No overt skin color changes, grooming is intact. And then I'm gonna get some vital signs. Are you in any pain on a scale of 0 to 10?
No pain.
Okay. So here I'm gonna hold for 30 seconds. Expected heart rate is between 60 and 100 beats per minute, and expected respiratory rate is between 12 and 20 breaths per minute. Before we get started, have you had any decrease in your hearing?
No.
Any loss of smell or taste?
No.
Any loss of your taste?
No.
Okay. Any pain or trouble swallowing?
No.
Okay. So Joe is alert. Do you mind telling me where you are?
Sure, the hospital?
At the hospital? Okay. And do you know what today's date is?
Sure. Today is Wednesday.
Thank you. So Joe is oriented to himself, place and time. So what I'm going to do is I'm going to inspect your ears. Your ears look symmetric in coloring. There's no lesions. And I'm just going to look. No drainage on this side. No drainage on that side. So no drainage bilaterally. And then I'm just going to touch your ears. Do you have any tendernesses?
No.
Anywhere behind your ear?
No.
In front? Okay,
No.
let me look this way. Any tendernesses or pain?
No.
How about in front?
No.
No tendernesses? Okay. Now what I'm going to do is I'm going to inspect cranial nerve 8. So I'm going to stand behind you and whisper something, and you just tell me what the word is that I'm saying.
Sure.
And I'm going to have you hold your left ear.
Okay.
Facebook.
Facebook.
Okay, and then can you hold your other ear? I have to get behind you.
Sure.
Okay.
Mailbox.
Awesome, thank you. So cranial nerve 8 is intact with the whisper test, and now I'm going to use my tuning forks. My tuning fork. So I'm gonna clap it and put it on your head. Can you hear the sound equally?
Yep.
Okay. Thank you. So hearing tone is equal bilaterally. Now I'm going to perform the RIN test. So I'm going to do the same thing. I'm going to activate it. I'm going to put it on the bone. And then can you hear it?
Yep.
Tell me when you can't hear it anymore.
No.
Okay. And then I'm going to activate it again.
Okay.
And put it in front of your ear. Can you hear it? Okay.
Yep.
Tell me when you can't hear it.
Stopped.
Okay. Thank you. And I'm going to do the same thing on this side. I'm going to activate it. Put it on the bone. Can you hear it?
Yep.
Okay. Tell me when you can't hear it.
Stopped.
Okay, and I'm going to activate it again and put it in front of your ear here. Can you hear it?
Yep.
Okay, tell me when you can't hear it anymore.
Stopped.
Okay, wonderful. So AC is greater than BC on the RIN test. Now I'm just going to inspect your ears.
Okay.
I would be using an otoscope in the office, but I'm just going to pretend this is the otoscope. So he's an adult. I'm going to pull his ear up and back. And I'm also going to pretend I have a flashlight so I can see. So the cilia and the cerumen are present. And then looking through, I can see the tympanic membrane and the cone of light. So the tympanic membrane in pearly gray. The tympanic membrane is pearly gray, and the cone of light is noted by the malalis. I'm going to do the same on this side. So I'm going to pull up and back. Cilia and cerumen are present, and using my flashlight and the otoscope, I see the tympanic membrane and the cone of light. So the tympanic membrane is pearly gray, and the cone of light is present by the malalis. Okay. Next, I'm going to inspect your nose. The skin coloring is good. There's no lesions. Your nose is midline. And there's no drainage. And then I'm just going to look inside. So the mucosa is pink and moist. And your nails are symmetric. The septum is midline. Also using my otoscope. And your nares are patent bilaterally. And then I'm gonna inspect cranial nerve 1 with a smell test. So I have just 2 scents. Just tell me if you can smell them.
Okay. Mm-hmm.
You can smell it?
Cinnamon.
Cinnamon, good. And then, let's see if you know this one. Can you smell this one?
Garlic powder.
Yes, okay. Garlic powder. So cranial nerve 1 is intact by the smell test. And then, sorry, do you need a tissue?
No.
Okay. So now I'm going to palpate your nose.
Okay.
Do you have any tendernesses anywhere?
No.
Okay. And then how about over here? Any
Nothing.
tendernesses?
No.
Okay. On the sinus pressures anywhere?
Nothing.
Okay. No maxillary or frontal tendernesses. And then I'm going to inspect your throat. Just have you look up, please. His trachea is midline. And I'm going to have you look over your right shoulder. I'm sorry, that's his left shoulder. Look over your left shoulder and look over your right shoulder. No JVD. All right, now I'm going to inspect your mouth. Your lips look moist, pink, and there's no foul odor that I can smell. And let me just see your teeth. Okay. And then open your jaw. I'm going to be using like a tongue depressor here. I don't have one. So tongue depressor, just put your head back, please. So the gingiva is not swollen, the buccal mucosa is pink and moist. There's no lesions in your mouth. Okay. Now I'm going to be inspecting cranial nerve 12. So what I'm going to have you do is just stick out your tongue and go, ah. Thank you. Cranial nerve 10 is intact via the tongue test, which is midline. The floor of the mouth is pink, moist, and without lesions. And go out one more time using this. And the frenulum is intact. And then I'm going to assess your pharynx using cranial nerves 9 and 10. So while his mouth is open, I'm going to have you go out one more time. Okay. There's equal rise and fall of the soft palate and the uvula, and his voice is clear. His tonsils were between the pillars +2 bilaterally, and the pharynx had no redness or lesions. All right, so is there anything else I can get for you before I get the doctor?
No, nothing.
Okay, thank you.
Thank you.